Magic 89.9.
Today's Best Music Magic 89.9. Lady Gaga with the song called The Dead Dance. This is Healthline. And you might be wondering, whoa.
With the dead dance.
Where with the dead dance? Because health is wealth, guys. The dead are literally alive and kicking.
Welcome to Healthline.
Welcome to Healthline. You might be wondering if ever you're on the road and then tuning in and expecting the wonderful and the great and the one and only Tina Ryan and Doc Rylan. But hey, it's
Junior Jack Izbel.
and Junior Jack JayJay keeping you company up until 8 p.m. We're subbing in for Tina because
She's in Bora Bora.
Bora Bora with an accent. Bora Bora.
Bora Bora.
Bora Bora.
And down under.
Down under. She's down under there. And then she has a wonderful gig. So I hope she's safe.
She's getting that bread.
Yes, we live for it. But for now, we're just waiting because
the professionals are coming. Did you
coming.
guys really think they would leave this to us? No.
I mean, okay, I went out of my way to try my best to look like a doctor.
I know.
But-
if you want to see the fit, playback Kati Pisas Magic 899.
I look like a doctor for the wrong reasons. Let's hope it's not the case. But
Better look like a doctor kesa pasyente, di ba?
Actually, oo. But the dead dance, I might be included there.
Exactly.
But yeah, if ever you're looking for health tips, I'm putting it out there. You can visit our Viber and send us a message. It's 0945-971-4011. And yeah, later on, Doc Rylan will be joining us. And we also have a guest for the second hour. So stay tuned for that.
For those actually listening to Healthline to look for health advice, if you have any questions, don't worry. They'll be coming in a bit. They did not leave the kids to do this.
But if ever you guys want to ask us for health advices, why not?
Why not?
We'll think about it. We'll think about it.
Yeah, exactly. But for now.
Yeah, for now, let's get back to more music. We got Disco Lines and Tinashe Down Under with a song called No Broke Boys here on today's Best Music. We are Magic
89.9.
Magic 89.9.
With Junior Jocks Izbel.
and JayJay. I'm trying to get used to it because we are not the professionals, guys. We don't even have the years of experience to actually...
Pinangarap mo bang maging doktor?
No, I wanted to be a lawyer because of the money and, for the so-called, I want to save people.
But doctors also do that.
I'm not scared of blood, but it's more of a, if I mess up, alam mo yun, that pressure.
Yeah.
So this is Healthline and we still don't have the professionals because we do have a looming question. And some of you who are like me, who doesn't have a 20/20 vision might be asking this. And
how does it feel to have to pay to see the world?
I'm like, it feels like I'm poor.
Do you feel cheated? But genuinely. Because I've never, syempre, I don't know how it feels to...
So skill issue. It's a skill issue for me to be partially blind.
Yeah, and I feel like I've seen posts on the internet about people who have astigmatism. Everything looks so shiny.
There's like sharp lines. Do you guys know the feeling where you're looking at lights? Or like the feeling when you're taking a picture and then the lights suddenly have
flash.
these like sharp lines extending from the lights. That's how we see it without eyeglasses.
Do you think it works out? Because there are some people who wear glasses just for the outfit.
Like
May insulto ka
aesthetically.
ba? Feeling mo ba hindi siya cultural
Like,
appropriation?
you guys, this is my sickness and you're trying to make it aesthetics. No, I mean like people are entitled to their own fashion. But I feel like I don't feel offended.
Okay, that's fair.
Unless they'll be using big terms like, oh, I have astigmatism. But wala naman talaga.
Have you ever been called names like Four Eyes?
Yeah. I mean, I'm called 4J nga eh. So I'm like...
Yeah nga, so Four Eyes must be
4
like
eyes
a walk
and
in the
4
park.
J's. And then now I'm being tagged over at Playback as a professor. Wow. Get one sheet of paper.
Hindi ka professor, ano ka, prefect.
Oh, like with a big body and be like, you guys, huh?
Yung may bell. Para
Ding, ding, ding. Recess is done. But this isn't done. By the way, it's 6:28. We still have an hour and a half before we get the professionals. Later on, we'll be joined by not just a doctor in the operating room, but someone who is a leader towards the betterment for healthcare, better for all kinds of Filipinos. But stay tuned because we're getting back to the music with this one. This is Sabrina Carpenter with a song called Espresso here in today's Best Music. Magic
89.9.
Magic 89.9.
Today's Best Music Magic 89.9. Katy Perry with a song called Birthday. This is Healthline with the Junior Jocks.
Izbel.
And JayJay.
Oh, may
Thank you.
pabulong.
May pabulong siya because that is dedicated to Pit Stop because they celebrated it earlier.
Their first anniversary.
First anniversary. They are now officially 1 year old.
Aww.
That is so cute. But welcome to Healthline. We are not professionals, but we are here not to give you tips because we can't
But
do
to
that.
give you the best medicine there
Give you the
is.
best medicine there is, and that is laughter because
Of
that is also
course.
that is everything that we can talk about.
That's the only thing we are allowed to prescribe you guys.
By the way, off air, I was talking to Izbel and I mentioned to her, why are doctors writing like that on their prescriptions, period?
Yung ano ba, parang squiggle lines lang.
Yeah, it's like a bunch of lines and then when you give it to the counter, they understand it.
I know, I feel like it's a subject under pharma. Don't you think?
Like
Doc writing.
Doc lingo ganyan.
Doc
They know na
linguistics.
when it's a certain stroke, they're like, oh yeah, this is a paracetamol. And then you'll be like, what? I don't know.
Pagkabilog lang, okay, pain reliever.
Also, speaking of a subject, so I asked my friend why they write like that. And apparently, doctors write that way because, one, it's efficient.
Okay.
And two, because there's a whole line of patients who want to get checked up. And I was
Okay.
like, okay, it makes sense. And then I asked him, so do doctors also talk like that? Like, bigyan mo siya ng orbitocin. It's slurry, not slurs, but it's slurry as well when they talk. And then my friend was laughing. But shout out to Gian. He's a great ongoing medtech student and he's gonna be a great doctor in
Pero
time.
parang nakakatakot yata makahanap ng doktor na ganun salita.
No, but imagine if they do, it matches their writing, and then the people over the counters get it.
If my doctor told to me na parang, Doc, so what's the best medicine for this? Sabi niya sa akin, Doc, kayo po yata may kailangan.
No, I would like, doc, thank you. That's why they write it down. Now it makes sense. But yeah, we're just laughing here because again, laughter is the best medicine, and it's the best thing that we can offer as we are not professionals.
Yes, but in all seriousness, if you want to get some advice from the professionals, in a bit, we will have some guests with us by the second hour.
We'll be talking about healthcare, patient experience, improving the patient care, and as well as Doc Rylan. We'll be asking him these stuff. But for now, we'll have the boy group of the nation, SB19, with a song called Bunka. You're here on today's Best Music. We are Magic
89.9.
Magic 89.9.
Today's Best Music Magic 89.9. New Jeans with a song called OMG. And OMG because we're
They're here.
The doctor's finally here. We can leave that. I'm just kidding.
No, you won't.
Dr. Rylan has gunpoint. You stay here, boy. You stay here. But yes, thank you. Finally, we're saved.
I know. Yeah, the doctor is finally in.
You handle it quite well. Thank you for holding the fort, by the way. Healthline.
Big boss.
This is Dr. Rylan here right now with you, without Tina.
Yeah,
Yeah,
Tina
we've been
is-
telling them Tina's in Bora Bora.
She's enjoying Bora Bora right now.
Exactly. Beaches.
She's going to get tanned and everything.
We're going to be enjoying the show, the rest of the show, that is. So thank you for holding the fort and welcome to Healthline, guys.
We have the professionals now. And in a bit, we'll be having our guest. Our guest is a wonderful... I can't say it right because I'm having trouble with my SS right now. Anesthesiologist.
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 Yes.
Anesthesia. Wow. Oo nga.
But basically,
So
it's
it's
The
like a
person
tongue
who deals
twister.
with anesthesia.
yeah.
Exactly.
Right? So that you feel no pain.
If you're doing, is it safe to do surgery without an anesthesia?
No.
Dude.
You want a shouting patient. You want a very violent and very rowdy patient. I mean,
Although I do have a bunch of questions to ask about those because I've seen the horror stories wherein they're under anesthesia but they still feel the
relatively
pain.
Feel and wake, right?
Yeah.
Oh, we'll ask the anesthesiologist in a bit.
I know. I hope you guys are excited.
She is here. Dr. Bernadette is here. And we're so excited because a lot of things... apparently today is World Patient Safety Day.
Yeah.
It's a special day for the patients.
So we'll dive into that as well as with healthcare, if I'm correct. So stay tuned for that. But before we talk, I'll be bringing you guys back to the music with a classic this time. She was recently engaged. It's everyone's favorite. We have Taylor Swift with a song called Enchanted. You're here on the Healthline here in today's best music, Magic 89.9.
Magic 89.9.
Cat's Eye with a song called Debut, and they're debuting at Coachella because the lineup was released, and oh my gosh.
Seriously.
There is a theory going on right now where
So what's the theory?
if you performed in Market live, you will be successful.
Yeah, I know
Both
that as
Beanie
well.
and
Beanie is
and
also
Cat's
there.
Eye performed at
Yes.
Market, and now they're at Coachella.
Saan ba yun? Punta nga tayo.
Market is near SM Aura.
Yeah, let's go to
BGC
Market
area.
Market. Perform.
We will be performing there. But before we perform, this is Healthline with Junior Jocks, JayJay, Izbel filling in for Tina Ryan, and we have the multi-awarded Doc Rylan Flores.
Multi-talented.
Yes, welcome to Healthline, guys.
And we have our guest for this evening. She's not only an anesthesiologist.
Wow, we got that right. We got that right.
But she was also a former president. Where was it again, Doc Rylan?
Well, it's a Philippine Society for Quality
in
Care
healthcare.
in healthcare. See,
So everyone give her a round of applause.
Yes.
We have Doc Bernadette C. Hoogar-Manlapat, MD.
let's call her Dr. Dindi.
Dindi.
Because the name is really so long.
Doctora what?
Dr. Dindy.
Dr.
Or
Dindy.
Doc Hogar, if they call me. It's easier.
Yeah,
Okay.
Dindi and then me, JayJay Ryan. So 2 syllables are a thing. It's
Exactly,
wonderful.
right?
It's wonderful. But for now, you wear many hats, right?
Yeah.
You were a doctor as well. You're also a leader. And I want to know more about your advocacy, especially for patient safety. What is it all about?
Thank you for having me, Rai, and the rest. It's actually the World Patient Safety Day.
That's today, right?
That's today. So it's really up. At this moment, as we speak, the city halls of Manila, Cavite, Quezon City, and the rest of the United Nations are lighting up their halls with orange light to celebrate.
It's really a global
It's really
thing.
a global thing. Yeah.
So it's not just ways having orange lines there, but that becomes red
Also,
eventually.
hospitals in the UN.
Should have told us earlier. We would have changed the whole sign and turned it
I know.
orange.
But I just knew about this. When did this start? The World Patient Safety Day.
Since 1990s, it was there, but it was just now recently that they pushed it forward so that everybody, social media had link to this. So we're very happy that the Philippines now is joining the advocacy for patient safety.
That's wonderful because I know when you say patient, they have to be safe, especially in context of
You'd
hospitals,
wish.
because they are going to hospitals because they want
Exactly.
to be well. But what is patient safety?
Let me begin with how you become a
Patient.
how you become
Marami yatang
safe
posibilidad,
with
Doc.
quality. Yes. A friend of mine, Dr. Manny,
Yes.
you remember him? I was asking, what is this quality and safety? Why do we need it? So, before the doctors dictate, diba? 10 to 20 years ago, and you listen. But now you become a partner with patient safety. It's now patient-centered care, as WHO Universal Healthcare is telling us. By the way, hello to Dr. Ted Herbosa. He's listening right now.
Yes, he's actually there right
he
now.
is. And Dr. Edwin Mercado, he just wants to say hello to them. And our friends from the Philippine Society for Quality in Healthcare. So, how do you become safe? The environment should be safe. You should know your patient. You should talk to your patient. So, before,
gone were those days when the doctor usually would just give orders and that's just about it. And most patients would just receive it and say,
Thanks, Doc,
like a teacher-student relationship. Like,
So it's very transactional.
You're not allowed to ask
But-
questions.
Exactly. But right now, we do encourage our patients to be involved in their treatment because trying to find out what their diseases are, what's going on at that particular time, is actually already half the battle. So with their treatments, we would want for them to be as much as possible interactive. They do ask questions and all of these stuff, because the more they know about what's wrong with them, the more they learn about how to actually be better, the easier it is for them to manage it.
And it's helpful for them to, I mean, on the side of the patient, to trust their doctors as well.
Exactly.
Others kasi would rely more on superstition or yung sabi ng lolo ko, something.
I think that's a cultural thing too, because whatever oil and ointments your lola or lolo gives you, you'd put it there. Parang, masakit yung likod ko, pahilot natin. Diba? That's what you have with the old generation. But then the newer generation, they'd say, I read on Google, I think these are my... this is what I have.
There's another one, not just Dr. Google. You now have Dr. ChatGPT.
Yes, Dr. ChatGPT.
Yeah. Let's leave it to the experts, you guys. They value patient safety, for God's sake.
But, sige, go on, Doc.
Yeah, but of course, before you become a patient, you have to prevent any individual from becoming a patient. That's now we're advocating preventive medicine, lifestyle medicine.
Lifestyle medicine.
Yes.
Because we've discovered that a whole lot of diseases, yes, they do have complications and all of these stuff, but most of them are actually very, very preventable. So I know it's cheesy, but it really is better for an ounce of cure than a pound. I mean, an ounce of prevention than a pound of cure. It's really, really true, because you tend to spend less when you actually make sure that your body and your medical condition is actually better than when you do get sick.
What is this lifestyle medicine that you mentioned a while ago? What's that?
It's a new, a relatively new branch of medicine wherein they concentrate on lifestyle diseases, and they concentrate not actually on what to do when you're already sick, but how to prevent these from happening, or if you do begin to have some signs and symptoms of it, how to not make it progress. So they do have trainings specifically for lifestyle medicine. They recently graduated a few batches already. They're based in Iloilo, if I'm not mistaken.
Yeah, in Iloilo now, they're in Makati, and
they have
the
branches
rest
here.
And the south at most.
We do have friends who've graduated. One of our guests here, Dr. Sushi Langkawan, by the way, hi, I guess she's listening, was a graduate of lifestyle medicine.
As well as Dr. Rai. It's not only an orthopedic surgeon, is really for prevention. So thank you for that, Rai. You know that before, a lot of doctors, of Filipinos and nurses are going out. And we learned in Europe and in Canada, in North America in particular, they're getting our nurses, and this is actually our advocacy. Now they learn that these nurses wanted to have more, and the Europeans and the North Americans and other countries are now going to the Philippines to study.
That's so true.
Yes.
That is so true. Not just nursing, but even for medicine.
Medicine,
so it's the other way around.
No, it's really now the other way.
Before we used to export our Filipino-ness, Filipino nurses, but now they're coming here.
Yes, not just, we noticed that there are increasing number of enrollees.
Yes.
Whether not just for medicine, but for paramedical courses like nursing, physical therapy, medical technologists, radio technicians.
The radio technicians.
So I'm really surprised that this patient safety.
Tama.
Usually, there's a certain standard that we have to follow. But you said a while ago about cultural. It depends. I mean, we're such a small country compared to others, and yet we'd have different cultures.
So diverse.
From the tip of Luzon all the way down
to
the
Mindanao.
Mindanao.
Different cultures, so that when we actually, by the time we start the scientific Western medication, there are a whole lot of things that we have to consider. So that's why we do have standards. Unfortunately, probably a decade or 2 decades before.
2 decades we've started this.
We do have standards, but not all adhere to these standards. So it's good that we actually have societies that Dindi actually headed, because they are actually encouraging
Yeah,
the standardization all over the country so that wherever you're treated, whether it's in the province, in a municipal, in a city, hopefully the management of
will
your
be
disease
the
entity
same, yeah.
would roughly be the same. Of course, it's different when you say that you're in a city and in the province because we all know that
Resources
in the
are
city,
also different.
resources are all
Accessibility,
here.
Cultural
But
and
in the province, it
difference,
might not be as much. But there are certain standards that we can adhere to so that we can optimize patient treatment and ensure that they do get well.
And it helps the foreign enrollees as well. When we have that standard out there, it's gonna be like, oh, this is branded Philippine standards yung ating patient care. It's wonderful. It's not only wonderful for patients, but also for, I'm believing, our status. We're known as having nurses all over the world.
Yeah.
But
That's so true.
I'm so happy that to finally see that you mentioned, guys, that there were doctors who come here
Exactly.
to learn.
We were able to talk to some of the students, even graduates, because others thought that when they do come to the Philippines to study, it's because they're having some form of a substandard education.
No, it's
but
not.
no, it's not. It's actually similar or the same or even more than our Western counterparts. But what the main difference is, it's not actually so much on the intellectual knowledge that you get from studying. It's more of the
all the
Filipino,
aspects, yes.
the Filipino culture of
Yeah.
actually caring
I
for
was
the
about to
patients.
say that I think it's innate in Filipino nurses and doctors to care a little bit more
True.
than with
That's so
Western.
true.
I don't think
That's
it's a
so
Western
true.
thing
the
na
nature of
parang
hospitality.
Exactly.
Oh, yes.
Hospitality is a big thing in our culture. And even though we never, or it was really early on na, or ngayon lang, that whole patient safety thing and it's being advocated and it's being on social media, I think it was always something that you see the TikToks, you see the reels where everybody's like, I had this Filipino nurse and she was so nice, right? Because we aren't heartless people. You see a person on a patient bed and you see them suffering. You give a little bit
empathetic,
more
eh. We were
care
yeah.
to them.
That's what we call your bedside manners.
Your bedside manners. True.
Let's talk
Diba?
about more of in a bit. No, we'll bring it back to the music, but I want to talk about later about elevating the standard. No, we want the standard
That's
in how
her
we
turf.
elevate.
That's her
That
turf.
is Doc Dindy's turf.
And what is the standard?
And what is the standard?
Exactly.
But let's bring it back to more music. We got Justin Timberlake with a song called Can't Stop the Feeling. You're here on today's best music. Your Magic
89.9.
89.9.
Magic 89.9.
Healthcare.
Yes.
I want to remind people that you can also ask questions over at playback.tv/magic899, or you can also visit our Viber.
Yes.
Which is a 09
45
9714011.
Wow! Shucks, bilib ako. Di ko nakita eh.
Grabe, naalala ko na siya. Okay, so we will be catering your questions. We do have one over at Playback,
Yeah.
which is by
Read it over there.
Negatron, and he asked, Doc, can I refuse epidural? What is epidural?
Well, I think the anesthesiologist
Yes.
would actually explain what an epidural is all about.
It's a space in between your spine, and you put your instead of the usual spinal anesthesia, it's a regional anesthesia. It depends actually on what operation you be doing or how long it is. So there's a tube, a very small one that you'll be introducing it, and it's very good actually even for post-op pain. So
So it's not just giving anesthetic, but
yeah.
even after the procedure is done, you can
Post
actually
care?
serve-
There's post care.
Yes,
Yes.
Your anti-inflammatories and pain relievers on that area.
yeah, so it's
But actually, I do have a question. Well, if you want to refuse, there is always the right of the patient
Yeah,
to refuse.
true.
But I'm sure your doctor would have
Explain.
given you
Yeah.
the pros and
Explanations.
cons and the indication why they're actually recommending an epidural. So I go on to that. What's the reason why or why not the epidural? So
that's actually how we do it with the Philippine Society for Quality and Healthcare. We encourage people to ask and their doctors to be your friends and the relatives as well.
not
Because,
necessarily
no,
friends and other.
Not friends like,
I just
Doc,
want to
can we
make
drink?
sure. I just want to make sure on
Doon kami
that.
tayo.
Or like, Doc, can I rant?
Ibang friends pala yun, you know?
when of course your surgeon, especially orthopedic surgeon, you really have epidural because depends on how long your your surgery will be, it actually helps you even, as mentioned, post-op pain.
Yeah, for post-op pain. Because if you could imagine, when the anesthesiologist gives you an anesthetic, they give it to you. So if it's a spinal anesthesia, they give it to you in the back, actually. And that's about it. They tip you over and we start procedures. But if the procedure tends to be a little longer than just probably a few hours, like 2 to 4
Depends
hours,
on the anatomy.
then you would need more anesthesia by then.
You have
So
to top up.
I mean,
The term
you
is
wouldn't
top
want
up,
to. You wouldn't want to position again the patient just to give the anesthetic. That's why there's that tube that Dr. Dindy was saying, because at the end of it's like a port that if they feel that the anesthetic is like kind of wearing off already, they kind of add
Top,
some
yes.
more. Top up
Top up.
is what they use. And simply
Parang
put,
load.
Load, yeah.
Or that-
Parang
or-
RFID lang eh,
Top up, and I'm like, because I've never had surgery. My wisdom tooth, I have one, but it's not impacting, so I've never had that.
I
Anesthesia. I don't
actually
have
have
an
to get
idea.
mine
you
taken
don't
out.
have wisdom at this point in time.
Yeah, I still have mine. I have my wisdom. It might not be obvious.
So
but-
it's actually for easement of the procedure ongoing, and like Dr. Ardidi said, it's not just during the procedure, but for some that really would have exorbitant pains, like probably a total joint replacement on the
a
knee,
hip.
on the hip, that the patients might be complaining of pain. They can still maintain that epidural even after the surgical procedure, so that they could give more medication even after surgery.
There's a particular anesthesia, we call it regional anesthesia, and there's a society for this, Regional Anesthesia Society of the Philippines. So we're part of that.
I was going to say, do they do systemic? They don't.
Hindi tayo Dr. Izbel.
Pero yung alam ko lang na
Sorry.
doctor si Meredith Grace.
I don't even
I'm
watch.
sure you watch Grey's Anatomy.
Oh no, actually I didn't. I watch the
Or the Korean ones.
Hospital Playlist.
Hospital Playlist.
That's the best.
Never watched any
Kailangan
of
pa rin
those.
kami lang dito.
Seriously, I mean, for what it's worth, these few shows are actually, well, okay. As far as the medical component is concerned, I would agree they're relatively true to life. Because if there's one person who would complain about what the heck is going on that really doesn't happen, is actually us doctors. Because we would know.
You guys would confirm it if
yes,
it's
as a matter of
real
fact, that's
or if
one
it's
of-
dramatized so
Actually,
much.
that's one of my jobs in the big
do,
networks.
yes, yeah.
But the other half, the love life and all, may not necessarily be true.
Oh no.
Because
that
I
part
heard,
is
I
entertainment.
heard a friend of mine say, you know, these the medical things are not real. The real is the love story and the doot, doot, doot.
But do you think cases like that improve what we call yung befriending your doctor, making them more comfortable?
I will go to the quality expert.
Seeing the doctors is like, oh, they're also human.
We are
we see a
human.
human
Yeah.
aspect
Oh,
of
I've
them.
heard that your doctors actually have the worst health condition. I've heard that from somewhere before. Na parang sila pa yung sakitin, sila yung hindi nagagamot.
Actually, no, not naman sakitin and
Resilient, it's a term.
yeah.
I mean, be exposed to
We're
somebody.
the worst
Filipino
patients,
doctors,
actually.
That's why my society tells you that before you go into a patient, you wash your hands, because hand hygiene is the best prevention of infection.
Oh yeah.
So we advocate hand hygiene. Yeah, less antibiotics, because now we
Yes.
also have the antibiotic management or stewardship. It means that you have to take less of antibiotics, because the now I don't know, even not only Filipinos, even the other countries, you take about, it's required 7 days of antibiotics. You're only taking it for 3 days because you feel better, and then afterwards that's when resistance comes
Resistance
Yeah.
comes in. So unfortunately, if you do become resistant to antibiotics, you have to move up in the step ladder of antibiotic
Medics.
treatment, which means you give either a higher dose, a different type of antibiotics, which relatively would not be oral anymore. It has to be passed through an IV line. And worse is, the higher you get on that step ladder, the more expensive
expensive
it
it is.
becomes.
Kasi money, we're talking about expensive, and people, syempre Filipinos, I myself am very frugal, but a lot of other tips would be like, paracetamol mo na lang yung antibiotics mo na yan. And I know that is bad, right? That is bad.
That's the reason why in all of our patients and in all of these programs like Healthline here at the Magic, we're not saying that like we know it all and do all of these things, but what we would really want to inculcate is actually, if you do feel something, you talk to a doctor.
Yes.
I mean, there are a whole lot of us everywhere in the entire country. I mean, there's health centers, there's Yakap centers now,
Yakap centers.
there's government hospitals, private hospitals.
Mobile hospitals,
so
yes.
you can
all of
actually
them.
talk to doctors and ask, rather than ask your neighbor as to...
Yeah, no, that is
As
part
what you
also of the culture of the Filipinos. Na you wait for it until it gets really, really bad na hindi na siya kaya ng over-the-counter medicine.
Ano lang to, lagnat lang
That's
to.
where your
Yeah.
lifestyle medicine comes in, because we would
exactly.
want everything to be preventive. We'd rather, I mean, try to think about it. Won't you rather go to the doctor and for the doctor to tell you, just hydrate and rest and you'll be fine in the next few days, rather than kind of scratch our heads and go, I don't think we can do anything about it anymore.
Yeah, because a yearly checkup would be better than having a
See us, us, at least once a year. That's the reason why you have your annual physical checkup. Most of the lifestyle diseases, you really wouldn't feel anything until it's worse. But your laboratory workup, your examinations would give a different cue a whole lot earlier than when you do manifest some form of
true.
symptom.
In fact, the other patients that we have, I don't know if before they develop, we see a mass sample of breast mass. They ignore it. Just they don't want to go to the doctors. But when they go to a doctor, it's as
bad
mentioned,
na.
it's bad na. So
Yeah.
if you can,
Especially for, now that you mentioned about breast mass and breast cancers. Okay, first and foremost, not all masses are cancers.
True.
So when you hear the word tumor, you say, oh my God, I have a tumor. The
like
tumor
malignant.
simply means...
there are two.
Yeah, the tumor simply means that you do have a mass, a space-occupying lesion. You still have to differentiate if that thing is what we call benign,
Benign, yeah.
which is just okay, it's just around
It's just a
that
lump
thing.
or something.
Yeah.
It's just a lump, or it's actually malignant. Malignant means that is already cancer. And with cancer, you do have that
Different stages.
stages, and the worst is you do have that possibility to transfer from one area to another. That's called your metastasis.
So here's the problem, no. With on the topic of tumors, a lot of them would be like, they feel something, be like, hello, ano na to? And then they would, instead of going to the doctor, they wouldn't go to the doctor. They would actually,
would stress.
as Doc Rylan mentioned earlier, Doc Google, or worse, right now, a lot of people, and I'd be lying if I say I didn't go there, Doc Chat GPT. I am here right now.
He's the newer dude.
Yeah, but with this, no, with the opportunity of using technology, like as you, Doc Dindy, no, as an advocate for like patient care, lifestyle medication, how can we utilize or maybe push people to not use technology as a way to confirm your sickness or something or whatever it is, but to instead go to doctors, ganyan.
Yeah.
Actually, now the technology is helping us. We don't want to
Yes.
erase those technology.
It's not us versus
No,
those.
no, it's actually
with.
It's teamwork.
Working hand in hand.
Yes, but we want to know your story. We want to know, do you have a history of this? Does your family have this kind of history? We want to know those things so that we will have a whole picture that will tell you and will tell you and share with you what the problem is.
Yeah, and we really do need forms of technology because we were talking about breast mass a while ago. The thing is, did you know that by the time you actually feel a breast mass, the size of which probably is already around 2 centimeters. So that's already that big, which
Yeah.
means anything less than 2, like if it's probably just a centimeter, you literally won't be able to feel it. And that is no
it's
matter what
pretty
size of breast you might have. But
Yes, I can confirm.
and so for that reason, we do need these
Mammography,
technologies,
yes.
ultrasound and all of these
radiology,
things.
yeah.
But less than 1 centimeter, your ultrasound also can't catch it. That's why the mammogram is the ideal or gold standard for breast examination, because there are actually some forms of cancers that are seen on a mammogram like they are literally just dots.
True.
And if we find them in a line, like we see like 6, 7, 8 dots
a pattern,
in a line,
ganun.
that simply means that since they're in a line, they're inside ducts, because the breast has ducts, because that's where milk's supposed to pass. So there's already lesions that actually passes through that area, which you literally will not be able to identify, feel, or have any symptoms whatsoever. That's the reason why, if with cancers, right, Vince? With cancers, if you do have a family history, like if your mom has had breast cancer, you have your
or any
grandmother,
cancer,
or any cancer for that matter. Normally for cancer screenings, we usually start 40, 50. But for those who have these family history,
as early as 20. Yes.
As early as 20 years old, we do monitor already, because cancer is already treatable as long as you catch them early.
True.
If you don't catch them early, then it metastasizes and it spreads all over, and we literally can't do much about it.
We keep on saying like, saka na or something.
So it's no longer lifestyle medicine; it's palliative care already.
Palliative.
Meaning that it's a care for terminally ill patients already.
Okay.
So we wouldn't want to go into that phase.
Yeah, and I think something we also have to debunk for people out there is that healthcare is only those for the rich. Because a lot of people will
Everybody
say,
gets sick.
exactly, and we are
Everybody
talking
gets sick.
about patient care and patient safety also, and we are going to be talking about the gold standard that you are trying to implement everywhere you go. Because people might say na parang, dun ka, meron naman may libre, right? There are health
Yes.
centers, government-run
Yes,
hospitals.
and now-
But some people think the stigma is that it is not the same type of care that you could get in privately owned establishments or hospitals.
Now we have the Yakap.
Yeah,
It's actually
the Yakap used to be
an extension of
the primary health care
care.
from the universal health care law,
Yeah.
but they kind of
It
are
added-
rebranding it.
We're branding it. We added gamot. It's
Yes.
for the medicine.
So
And cancer care, pre-cancer care. It means that a colonoscopy being done because preventive, you have to look at, because you have a history of colon cancer in your family or stomach
Yeah.
cancer, you have to look into those.
just to do a checkup for a primary healthcare facility, you get your consult, you get your laboratories, you even get some form of medications if needed. But the good thing is, when you go beyond this, obviously everything else will be out of pocket. There are different packages
Packages
from
for
the Philippine Health
PhilHealth
Insurance or the
Company.
PhilHealth. So nowadays, even our president goes for the zero balance billing balance. So literally everything will be paid for as long as you get to be admitted in a government hospital, especially a DOH hospital, in the ward where treatment would be done. Which means that one, if the emergency room isn't included, simply because you're still an outpatient when you're in the emergency room. That's why you have to be admitted. And then two, you have to be admitted in the ward, not in a private room, because there are some
Yeah,
hospitals
they wanted,
who actually have, how'd you call this? The private floors or the
Floors.
private setting. The moment you get to the private areas, then you do have to pay some form of fees already. But if you are admitted in the ward, in a government hospital, specifically a DOH hospital, then the zero balance billing comes into play. You literally don't have to pay for anything.
Yeah, true.
We have a question over playback, but I like this topic and we can talk about it later. But this might be for me as well. This question of playback.
Now I'm curious about
somebody
it.
said,
Oh my
Doc,
God.
bawal inom alak pag nag-antibiotics. Reset po ba pag nag-inom? But disclaimer, I'm not
We're not on antibiotics. We're not
Pangunahin ko yung
alcoholics either.
anesthesiologist.
But we actually, it's a common question
It's
for
a
the
common
kids.
question, yeah.
Actually,
Not just the kids.
no, alcohol really is not really encouraged because when you
I like that term.
When you say not encouraged,
It means
you
like
do
there's a
know that
1%
people
chance.
will still drink.
yes, but when you're really in antibiotics or you are because you are sick, you really have to stop whatever alcohol or you're drinking because it has reaction to your any medication.
And not only that, it does have a reaction, but the problem is, the big question is, how much alcohol really will you consume? Because they usually say, oh, Doc, 1 bottle of beer, 1 shot of my favorite poison, or a glass of wine.
Yeah, because
And
after
then
that, they forget how
I'm
much
gonna
they
say,
actually
yeah,
drink.
right. I actually lose count after 2, so I know how that feels.
In my head, I only took 1 can of beer, and then
But after that,
In your head.
when I wake up, why is there like 3 cases?
Okay.
Sometimes I'm very scared. Like whenever I have even vaccine shots, diba? They say don't eat this type of food, don't drink.
Yeah.
Well, there are some precautions that are given, but it's not an automatic thing, which means that, okay, categorically, when you do take one thing and then you do another, like take alcohol or eat seafood and all of these quote-unquote malalansa food, the thing is, it's not an automatic thing that you'll get a negative reaction or a side effect. But it's just that, why risk it?
Yes,
I mean,
why you risk
you're
it to
sick
prevent-
already.
yeah.
You're doing all these medicines. Antibiotics are relatively expensive. So why not make sure that you get the maximal benefit
Don't
of
risk it. It's your
Don't
health.
risk it.
Yeah.
So
We are
I
for
mean,
prevention.
If you really would want to take it, make sure that you're done with your antibiotics already.
If
But
you cannot help it, don't blame the antibiotics for it.
No.
not
I
working.
do have this patient, Doc, kasi talaga mamaya, birthday ko bukas po, and mamaya may
Yeah, exactly. Sabi niya, tikim lang, Doc, may birthday daw.
Oh, eto naman sasabihin ko, my birthday. Hindi mo naman birthday, hayaan mo na. Kung birthday mo siguro, payagan kita na 1 bote.
Saka, the goal is, maabutan mo yung susunod na birthday.
True.
Exactly. So relatively, we'd rather not. I mean,
Yeah.
because some would say that, I mean, nothing's gonna happen. Okay, at
You
one
don't
point in
know.
time, I will agree with you on some form, but why risk it? Although our bodies are quite similar in one way or another, we are still different in a whole lot of things, genetically, metabolically, and all other aspects, that we just might get a bad response if we do some of these things that are not supposed to be done.
So we have also a bunch of questions about anesthesia. Somebody asked, is it true na pagka nasobrahan na anesthesia, there will be some memory loss?
No, hindi totoo yun. Yung iba, hindi pa na-anesthesia, may memory loss na.
I know.
Baka nagkaroon na ako kaya hindi ko maalala.
No, the funny thing is, I've also heard a lot of older people tell me na parang, kaya siya ganyan kasi may anesthesia siya natin ng bata. Sabi ko, hala?
That's so true.
Sasabihin, bago nakakalimutan, baka makalimutan
Fallacy.
kong batiin to. Of course, the staff in Security Bank in Eton Centris, hi, they're all listening right now, especially for Grace. Thank you so much.
We have a question here, and I think it's a quick one. I think it's on the concept of patient safety pa rin, ano? They're asking about DNR. What specifically about DNR?
Do not resuscitate.
Do not
Oo.
resuscitate.
So in an area, we actually explain and there are cases that end of life. You're chronic, and again, as mentioned, you have metastasis all over. You have to explain to the relatives, because usually DNRs are patients at ICUs and in chronic cases. You have to explain that they have to sign this do not resuscitate. Even actually, as early as now, if you feel that it's your right, that if you have this kind of if you see those kinds of symptoms, it's you have to have a consent for this. You have to stop the special medications that prolongs life. But because even if you, this is actually ethics, a part of quality, you measure if you want to prolong this, is it worth it?
Because if you, when we did pass the board exams and we got our licenses, we actually swore an oath. That's your Hippocratic oath.
Yeah.
Go Google that. So we do have
They
the
promise to take
Hippocratic oath.
good care of you.
Yes. So
Please,
it literally means that do everything that needs to be done. Exactly. Do everything that needs to be done for the betterment of the patient, for the patient to actually survive and live. But there are some stages that it's really quite impossible for the patient to actually to survive. And
And
the
the
thing
best
is,
course is-
if
No, you just let it be.
Let it be.
if this patient kind of ends up, meaning heart stops, lung stops, your brain stops, then all of these functions, we have the obligation to literally revive these patients. That's the reason why you see in these dramas where you do compressions and all of these other things, like they put in tubes via the laryngoscope through the mouth, or they put IV lines, give all of these tons of medications just to ensure that the patient is supposed to survive. But there are some cases that literally the outcome might not be positive anymore. So that's where we do talk to the relatives because it's their decision. Or it might be the patient's decision when he or she was still coherent to say that, you know what, when this time comes, nobody touched me already.
No.
And then
I think
there's
that's
supposed to be a written statement, a written document from the patient. But
And
if
notarized as well.
yes, but if not, it's the duty of the doctor to
Stand by
not
their
really
oath.
advise, but
Or-
just to give the details, the facts
The pros
of what's
and cons.
happening to the relatives of the patient, and for them to decide that if and when the times come, I mean, you're not killing the patient,
no.
but if and when the time comes that they really succumb, then the next question is, what's to be done next? Do we become aggressive, call for a code blue, or depends on the hospital what kind of code they call it, where everyone comes to the room and they do
resuscitate.
all of the things just to ensure resuscitation. But if there's a DNR or a do not resuscitate document that says no matter how much you would want to help, you're legally bound not to do anything.
Also, just to lighten the mood a bit, I saw it. Let me know if it's true because I want to know. For like first aid, for CPR, is it true that you can go to the beat of Staying Alive?
Oh, no, there's a new one now. Staying Alive was for the old ones.
Yes.
You can actually sing Golden and do your...
Oh, really? And
Exactly.
compressions,
I did
too.
that. That's actually 60 and everything. Yes, exactly. Exactly.
Oh, so it's not just a bop, it's actually possible.
It's saving lives.
It's saving lives.
But just for it being ironic, I still want to do Staying Alive.
Because the idea was
encouraging the
you
person.
want to encourage it to stay alive. In CPR, because of COVID and everything else, there's no longer that rule of several pumps and then there's breath of life, as they call it. But nowadays, not anymore, because what they've learned is that method compared to what they call now a continuous chest compression,
compressions.
meaning you literally just pump and it's like 100 to 120 beats. So your golden refrain is actually 60 in 30 seconds. So that's 120 in 1 minute. That's what we do right now.
The more you know, it's updated. I feel like every generation has a song.
It's an updated
right?
song. But
Yeah.
Staying Alive is still the key, especially for the older ones.
Someone is asking over playback, Doc, my son undergoes triple IP every 2 months. He needs fasting pero minsan ang tagal dumating ng anes and hema onco. How long ba talaga pwede last meal? Usually his procedure starts 11 a.m.
It depends on what procedure and what
IT.
they will do.
The reason for any procedure to be done, not just this particular procedure, is that we want to ensure that there's nothing in your stomach. Because it's not so much as the problem of the food, but if you become
Sedated,
you become very, very lax because of what Dr. Adinde will do to you, then the possibility of regurgitation of any contents in your
Aspiration,
stomach, which means that you might, excuse it, but you might puke through the procedure. And the thing is, it's not the puking that's a problem. The problem is any material coming from your esophagus, from your stomach, might go into your
lungs.
windpipe, your
windpipe.
trachea.
Yeah.
That's where you get aspiration pneumonia. So it could be even lethal. That's the reason why we ensure that there's no food already. Now, how much time frame? The normal emptying time of a stomach is around 4 to 6 hours. That's the reason why for any procedure, we have to count at least 6 hours before we do any procedure.
Like bloodletting or
No, not yun.
anything procedure.
Any procedure in particular, especially if it will undergo whether it's local, regional, or systemic anesthesia,
anesthesia.
because the likelihood of you becoming so lax, or
because the soft tissues that are lax.
or becoming so scared that you literally hide you.
True.
So it's more of that time frame. Now, if it's just for a simple examination, the 8 to 12 hours, average of 10, is what we follow.
Well, my dad, ako na to no? Diabetes runs in our family. So we have that checkup for blood sugar, glucose,
Yes.
right?
Yeah.
But sometimes we get turned away from our clinic because we overfast.
Overfast.
You overfast.
Yes. Okay, here's the thing. If you're really that hard-headed, they could still get your blood. Because some would say, "We've traveled far, and you just
I
get my
woke
blood."
up at 5, gutom na ako.
Yeah, they can still draw blood, but you notice that they will put their overfast. Why?
Overfasting.
Because the reason for that 8 to 12, that's like your
sugar.
some form of a bell curve,
Yeah.
wherein you can maximize and ensure the amount of sugar level in the blood.
Yeah.
So which means that if it's overfast, the likelihood of you getting what we call a false negative result, which means that you might have good results, but just because you fasted way longer than what's supposed to be. So it's not an objective result. So they still can draw blood, but they will put their overfasting. And if we see results that are normal or even low,
It's a false
then
negative.
it's a false indication that you have normal. That's the reason why we would still request for a true fasting blood sugar, or nowadays your HbA1c or the glycosylated hemoglobin,
months.
which is the average blood
sugar.
sugar levels for 3 months.
So
Para
there you
walang
go, guys.
dayaan.
Yeah, oo.
Tamang oras
Kasi
dapat yung
others,
fasting.
the diabetics, the relatively new ones, literally dinadaya nila.
Yes, oo.
They overfast.
So they overfast.
So that
they just don't claim.
So that it will be so low, so they'd still get normal results. But that's a false negative result.
And it doesn't help anybody.
No,
Exactly.
it doesn't help.
Exactly.
And
Just
there's-
lying to
You'll get
yourself.
sick, your doctor doesn't give you the right meds.
And there's a condition like rebound hyperglycemia.
Hyperglycemia, yes.
Pati dito may rebound. What does that
Oo.
mean?
Hindi love life
Hindi
pinag-usapan
love life.
natin dito.
Gamot guys, gamot.
So you overfast, and instead of having a very low that you've wanted to show your doctor, it becomes so high that you're diagnosed to be a diabetic or pre-diabetic, and you're not, because that's how our body works. So
Exactly. And for diabetes, if you're not yet diagnosed, even if it's you have a strong family history, but your results are honestly normal, that's where your lifestyle check would come in. Not lifestyle check because of the type of car or house you have, but lifestyle check on what you eat, how you move, what you take in as far as hydration and all the supplementation, and even what's not supposed to be done. You're smoking, vaping, you're too much alcohol, and even drug addiction. Which, by the way, will be our next week's topic.
While we're on the topic of we're doing preventions na we're doing what steps to take. We'll go down to the last two questions. What can ordinary Filipinos do when they go to the hospitals and make sure they are active partners? And at the same time, what would your advices be for doctors and other nurses to be active then in helping these Filipino patients?
everything starts with one hello.
Kanta yun na.
I know, but that's what you remember. You say hello because your other people go there because there's something's wrong with them. But as you're a doctor, you're a nurse, especially Filipinos abroad, they actually say hello to everybody, because in other courses, when you say hello, it's taboo. No, in our country, you should
because they misinterpret it for one thing.
yeah, but we encourage our patients to ask questions from their doctors. Filipinos, even before, don't ask questions, you just listen.
That's
now
true.
we're encouraging people to partner with your healthcare workers, your nurses, because we want to know the whole picture. And you are now our partners and doctors. We hear you, especially the younger ones.
True.
Now we really need to have the true story of this patient and the relatives.
The patients nowadays are partners
Yes.
in their management of their disease entity. It's no longer a one-way
not
street
transactional.
from the
Yeah.
doctor
Yeah,
to
no.
the patient. It's now be participative. Just don't throw us this whole thick of printed from ChatGPT and Google. I mean,
I think the technology, ChatGPT and Googling can help you get
True.
an idea of
yes.
what
Yes.
you might have. And you can, it's not a crime to tell the
It's not
doctor,
a
but
crime.
I think it's something like this, it's something
That's
like
so
that.
true.
That is so much better than hiding your
Exactly.
symptoms.
Yes.
And it's, guys, when you do these tests, it is not a test that you can pass or fail. And
It is
for
something you need.
it is something you need.
It's
You have
what-
to be truthful.
It's what your medical condition is currently going on and going
Yeah.
through. Are you literally well, or you're not, or you may be in the verge of not being
Yeah,
well.
true.
So these connection making, no, connection building with the patient
Yes.
and doctor is evident because somebody on playback, I don't know if it's your patient or Doc
Curious ba?
Dindy's patient, because somebody said here, Doc, I forgot to go back sa last checkup ko. Ha ha. It's Keith. It's an individual named Keith.
Yeah. I'll be waiting for you.
Ayan, it all starts with the
my
simple,
No, but
simple
for,
hello.
for us, it's we literally would have. That's the reason why you have your doctor-patient relationship.
Yeah.
Relationship, not the
Not that
Yeah,
kind.
not that
clinical,
kind of
the
relationship.
clinical.
Yeah.
So it's wherein you get to know each other, and by then you not just get the comfort, but you get to trust because you get all of these interactions going on rather than. And don't be for our listeners here on Health Watch. Don't be afraid to talk to your doctors, because others would say, "Nako, ayoko lapitan doktor ko, sungit-sungit ay tsura, tingnan mo." But no, we're even if we look masungit, diba?
No, we are not.
We are literally approachable. Just don't approach us if like we're doing something or talking to another
another
patient or
patient.
something. But yeah, don't be afraid to talk to your doctors, because they're the best persons to tell you what might be wrong with you and what might be
Normal.
the treatment
Yeah,
for
yeah.
you.
Okay, so it looks like we have a lot more questions, but we are pressed
I
with time.
know.
It's so, I mean, like
Time flies so
earlier
fast.
we were like joking
Yeah.
around, like, oh my gosh,
What are we gonna
what are we gonna
say?
say? And
We
we're
don't
like,
know
I'm so-
anything.
we're
You're gonna
going
say
home
a
with a lot of information, and you know what? I might go to my doctor. Wow, and I'll start
might
it
meet up with my
he'll-
doctor.
Yeah, and I'll say, hey doc, I'm back. But,
Dito bang situationship yung doktor?
thank you so much, Doc Dindy. Is there anything you want to plug? You do
Yeah.
want to do shout outs or anything?
Our society is assisting different healthcare units, both private and government units. In fact, next week we have a virtual webinar on continual improvement programs for your hospital. It's
Wow. That's
infrastructure.
free.
A little.
Yeah, okay.
And we have an annual convention this November 13. I'm sure you'll be there at the Crown
Yeah,
Plaza.
I will be there.
So.
I'll be attending that.
And PhilHealth partners with us, and as well as the International Hospital Federation.
That's so great. That's so great.
Any shout outs before we let you guys go? Yeah, you want to say hi to anybody?
Yes.
Ilabas na ang
I
listahan.
think she has a whole list on her phone.
Yeah.
She's been.
I know.
She's been typing names. Oh yeah, this doctor nga pala. Oh.
Oo nga. Tomorrow we have an OR, Dr. Marco. He's a surgical oncologist. So we have a
Lista nyo
patient.
na, guys.
Oo.
Kung ano mang lista nyo na yung mga doktor na.
Mga people to reach, no?
And of course, with this, because it's the World Patient Safety Day, Manila is really on top of this. I'm the quality officer of Manila. So
That's why she ensures that Manila's on top of it.
yeah, but we have lighted Manila City Hall, orange lighting, in the different hospitals of Manila.
Wow, that is
so
beautiful.
cool. That's so cool.
So to remind everybody that we have to partner with all of our patients and our healthcare workers. We're approachable now. But because we want to hear you, please email us or email 89.9 for any queries. Email Rylan is very
Yeah, you can reach Dr. Rylan as well.
Or tune into Healthline.
health.
Yes.
Every
Wednesday, 6 to 8 p.m.
But that's it for us. Thank you so much again, Doc Dinty and Doc Rylan. No?
Yeah.
We wouldn't we don't
We
know
wouldn't
why
have gone this far.
we would just be making jokes and everything.
But you
Believe-
guys were really good. Oh, I just want to add, next week actually is the 4th week of September. By law, by proclamation 493, if I'm not mistaken, all the way from President Carlos P. Romulo, it's designated as the Medicine Week. So there's a whole lot of activities the entire week, and there are medical missions and all for the National Capital Region. There's at the Philippine Medical Auditorium from Monday to Friday. There are a whole lot of medical missions you can drop by. You don't need to be a Quezon City citizen just to be looked into, so you can come from anywhere. But for those in different areas and different provinces, there are component societies who will also be doing all these projects. So you can just try and see with your barangay or your health center and coordinate with them. So it's the Medicine Week this coming week. So hopefully it'll help that. Go ahead.
Yes, other people are asking me, how can we participate in the quality advocacies
Yes.
of our country? We have a Philippine Society for Quality in Healthcare Academy. So we really go to different hospitals
For training and all
for
these
training
things.
and schools, and
That's
we
nice.
now go down to even the high school level, so that we have to prevent and do quality and safe healthcare.
Education really starts young.
True, yes, I have to train them.
Well, thank you so much for the very informative talk. No, grabe.
I learned so much.
I learned so much.
Feeling ko
Isbel-
nag-med school na. Wow.
Actually, Isbel asked me kanina
Hopefully yung
if I ever
sulat mo
wanted to
hindi
be a
katulad
doctor.
sulat namin.
Oo.
Because you were saying a while ago.
No, I feel like I write better cursive. So feeling ko di ako pwedeng doktor. Feeling ko qualification
So
siya.
EMR was
That's the reason why EMR was developed.
If you guys have any more questions for our dear doctors, you can reach them at...
Well, Vince, where?
Where can they reach you?
you could call me anytime. Care of the Anywhere.
No, our social media.
24/7.
Social media.
Just go to Facebook, Doc Rylan, Rylan, and you can give us a message there, or even do consults if needed, and or any assistance we can give you, not just financial ones.
Not just financial ones. Not even relationship.
The relationship we can work without some of them, but not all.
There are some relationship problems that just have
It's
to
like
end. DNR.
we just don't fix broken bones. We also fix broken hearts.
People that play baka, you know that. Reach Doc
and
Rylan.
our society has a Facebook page. It's a
go ahead.
Pisqua Facebook page. Of course, IG and the different social media platforms are there. You could also reach me via Facebook at Bernadette Hoogar. So you can answer any question. And thank you, Rylan, for inviting
No,
me.
thank you for coming.
Thank you.
And we've gone beyond our 8 o'clock time.
It's like the phone is ringing. The phone is ringing.
Yeah.
We're bringing you back to more music. Earlier with the Golden na, diba, is the one for CPR.
CPR.
So we're playing Golden by
You
Jocks.
can practice.
You can practice,
your
guys,
CPR.
while this is playing. So here, thank you guys for tuning into Healthline. This is Magic 89.9.
Magic 89.9.